Hello, dear aspirant. Welcome to the RK Pharma. Welcome to the class. Today we are going to discuss top hospital pharmacy MCQ. Hospital pharmacist pharmacy जो कि आपके DM ER एग्जामिनेशंस के लिए मोस्ट इम्पॉर्टेंट होने वाले हैं. ठीक है. सो दोज हु आर न्यू टू द चैनल को सब्सक्राइब करना है एंड बेल आइकन को भी प्रेस करना है. एंड जिन्हें DM ER के लिए टेस्ट सीरीज चाहिए थी, काफ़ी स्टूडेंट पूछ रहे थे, तो DM ER टेस्ट सीरीज देखिए कैसे लेना है. RK फार्मा आपको चैनल दिख रहा है, जस्ट उसके बाजू में ज्वाइन बटन दिख रहा है. आपको ज्वाइन बटन में जो DM ER टेस्ट करके लिखा है 2025, जो कि जिसकी कॉस्ट है 199 रुपीज़, ये आपको बाय करना है. बाय करने के बाद सिंपल मुझे एक टेक्स्ट कर देना ऑन टेलीग्राम चैनल. ठीक है, गॉट इट. सभी को समझ में आया. एंड जिनको टेक्स्ट बुक बाय करनी है, टेक्स्ट बुक बाय कर सकते हो आप. लिंक गिवन है इन द डिस्क्रिप्शन बॉक्स. ठीक है, लेट्स गेट स्टार्टेड टुडेज सेशन. क्या करने वाले हैं हम? हॉस्पिटल फार्मेसी के जो इम्पोर्टेंट क्वेश्चन है, जो कि प्रीवियस ईयर क्वेश्चन से PYQs है, जो कि TCS ने पूछे गए हैं. ठीक है, TCS में पूछे हैं ऑलरेडी. सो दिस इज़ द लक्ष्य बैच जो आपको फ्री ऑफ कॉस्ट मैं अभी प्रोवाइड कर रही हूँ, बट आफ्टर सम टाइम हो सकता है कि इसे पेड कर दूँ. बिफोर दैट आपको सारी क्लासेस कंप्लीट कर लेनी है, क्योंकि एट द जुलाई एंड या फिर जुलाई अगस्त में, अगस्त स्टार्टिंग में आपकी एग्जामिनेशन हो सकती है. तो मैं चाहती हूँ कि काफ़ी सारे स्टूडेंट को सारा बैच फ्री ऑफ कॉस्ट मिल जाए. ठीक है, एंड इसे आपको क्या करना है, सभी के साथ शेयर भी करना है. ठीक है, लेट्स गेट स्टार्टेड. सो दिस इज़ आवर फर्स्ट क्वेश्चन इन दिस क्लास. हॉस्पिटल फार्मेसी एंड क्लिनिकल फार्मेसी आज हमें पढ़ना है, जो कि आपके DM ER एंड नवी मुंबई एंड कल्याण डोंबिवली के लिए बहुत इम्पॉर्टेंट है. इसमें TCS ने जो PYQs लिए हैं सारे कंडक्ट किए गए हैं. ठीक है, लेट्स गेट स्टार्टेड. द फर्स्ट क्वेश्चन, हॉस्पिटल फार्मेसी सर्विस आर प्राइमरीली डायरेक्टेड टुवर्ड व्हाट्स? द फर्स्ट वन, रिटेल सेल ऑफ मेडिसिन. Second one, patient center pharmaceutical care. Third one, manufacturing of drug. And the last one, academic research. Which one is the correct one? Hospital pharmacy service are primarily directed toward what? तो किसके सर्विस किसे डायरेक्टेड होती है? टुवर्ड व्हाट? तो ये होता है पेशेंट सेंटर एंड फार्मास्यूटिकल केयर. पेशेंट सेंटर एंड फार्मास्यूटिकल केयर. पेशेंट सेंटर्ड फार्मास्यूटिकल केयर. आपको इसके एब्रीविएशन भी पूछ सकते हैं. ठीक है, जैसे पीसी क्या होता है? तो पेशेंट सेंटर्ड फार्मास्यूटिकल केयर. याद रखना है. ऑप्शन बी इज द करेक्ट वन. मूविंग टू द नेक्स्ट क्वेश्चन. क्वेश्चन नंबर सेकेंड, विच एक्ट गवर्न द लाइसेंसिंग ऑफ हॉस्पिटल फार्मेसी इन इंडिया? विच एक्ट govern the licensing of hospital pharmacy in India? The first one, DNC Act 1940. Second one, Pharmacy Act 1948. Drug Price Control Order 2013. Then Indian Medical Council Act 1956. जैसे कि आपको लास्ट टाइम आई थिंक पॉइजन एक्ट कुछ गलत दिया था. इन केस पॉइजन एक्ट 1999 ऐसा कुछ दिया था, जो कि 1919 है प्रिजन एग्जामिनेशंस में. तो आपको एक्ट भी किस ईयर आया था ये पता होना चाहिए. आज या कल मैंने आपको ईयर्स एंड एक्ट वाला जो ईयर्स एंड एक्ट एक ये डाला था ग्रुप पे मैसेज, आप देख लीजिएगा. ठीक है, या फिर प्रीवियस क्लासेस में ये भी लिया है हमने. ईयर एंड एक्ट वाला जो है वो सब ऑलरेडी कंप्लीट किया है. ठीक है, तो क्वेश्चन पूछा है कि विच एक्ट गवर्न द लाइसेंसिंग ऑफ हॉस्पिटल फार्मेसी इन इंडिया? तो विच एक्ट? दैट इज DNC एक्ट 1940. क्या था? DNC एक्ट 1940. ऑप्शन ए इज द करेक्ट वन. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 3, द फार्मेसी एंड थेरापेटिक कमिटी दैट इज PTC इज रिस्पॉन्सिबल फॉर? PTC का आपको लॉन्ग फॉर्म पूछ सकते हैं. जो कि आपको ऑलरेडी पता होता है, बट इसमें जो स्पेलिंग होती है वो भी आपको देखना होता है। कभी कमिटी दिया रहेगा, कभी कम्युनिटी भी दिया रह सकता है, तो बी केयरफुल अबाउट दिस। ओके, द फार्मेसी एंड द थेरापेटिक कमिटी इज रिस्पॉन्सिबल फॉर व्हाट? द फर्स्ट वन, सेटिंग द हॉस्पिटल रूम रेट. Second one, selection of the drug to be included in the formulary. Third one, recruitment of medical staff. And the last one, managing hospital finance. Which is the correct one? The pharmacy and therapeutic committee is responsible for होता है selection of the drug to be included in the formulary. क्या वर्क होता है? Selection of drug to be included in the formulary. Option B is the correct one. Next question. In the hospital pharmacy, the term centralized sterile service department, इसका लॉन्ग फॉर्म बहुत बार पूछा गया है। सेंट्रलाइज स्टेराइल सर्विस डिपार्टमेंट, ठीक है, refers to what? The first one, centralized procurement of medicine. Second one, sterilization of surgical instrument and supplies. Third one, storage of narcotic drug. And the last one, distributions of IV fluid. Which one is the correct one? In the hospital pharmacy, the term CSSD refers to what? क्या रेफर करता है? ये रेफर करता है स्टरलाइजेशन ऑफ सर्जिकल इंस्ट्रूमेंट एंड सप्लाईज। क्या करता है? स्टरलाइजेशन ऑफ सर्जिकल इंस्ट्रूमेंट एंड सप्लाईज। नेक्स्ट वन, विच ऑफ द फॉलोइंग बेस्ड डिस्क्राइब अ टर्शरी केयर हॉस्पिटल? द फर्स्ट वन, प्राइमरी केयर सेंटर इन द रूरल एरियाज. Second one, multi-speciality hospital that provide the highly specialized care. Third one, urban clinical with the outpatient service only. And the last one, small community health center. Which is the correct one? Which of the following best described a tertiary care hospital? Which one is the best described? That is multi-speciality hospital that provide the highly specialized care. क्या करता है? स्पेशलाइज, हाईली स्पेशलाइज केयर को क्या करता है? प्रोवाइड करता है. दिस इज द टर्शरी केयर हॉस्पिटल फंक्शन. ठीक है, ऑप्शन बी इज द करेक्ट वन. मूविंग टू द नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 6. द पीटीसी फॉर्मुलरी इज अपडेटेड हाउ ऑफन एज per the best practice? The PTC formulary is updated how often as per the best practice? The first one, weekly, monthly, quarterly, and the last one, annually. Which one is the correct one? So क्या होता है ये होता है that is quarterly. क्या होता है? Quarterly. Option C is the correct one. Moving to the next question, question number 7. Which inventory control technique classify drug based on both consumption value and turnover rate? Which inventory control technique classify drug based on the consumption value and turnover rate? Which is the correct one? ABC analysis, VD analysis, FSN analysis, XYZ analysis. Which is the correct one? तो ये क्या होता है? ये होता है that is XY analysis. क्या होता है? XY analysis. Option D is the correct one. Next question. Question number 8. VD analysis in the hospital pharmacy used to prioritize drug based on. VD analysis is VD analysis in the hospital pharmacy is used to prioritize drug based on what? Cost and uses frequency. Second one, vital, essential and desirable कैटेगरीज. ये आपको पूछा था किसमें? DHS में शायद, है ना? DHS या ZP में पूछा था इसको लास्ट टाइम. उसके बाद एक्सपायरी डेट एंड लास्ट वन स्टोरेज कंडीशन. विच इज़ द करेक्ट वन? सो ये क्या होता है? ये होता है दैट इज वाइटल, इसेंशियल, डिजायरेबल कैटेगरीज. क्या होता है? वाइटल, इसेंशियल, डिजायरेबल कैटेगरीज. ऑप्शन बी इज द करेक्ट वन. Next question, which record must be maintained for the Schedule H drug in the hospital pharmacy? Which record must be maintained for Schedule H drug in the hospital pharmacy? First one, patient counseling record. Second one, drug purchase invoice. Third one, prescription record for at least 1 year. And last one, adverse event report. Which is the correct one? That is prescription record for at least 1 year. Which record must? Prescription record for at least 1 year. Option C is the correct one. Moving to the next question, question number 10. The primary function of the Drug and Therapeutic Committee, that is DTC, क्या होता है? Drug and Therapeutic Committee is referred to what? The first one, supervise clinical trial protocol. Second one, ensure the rational drug use and monitor the adverse reaction. Third one, manage hospital criteria, service, and third one, oversee hospital building maintenance. Which is the correct one? So क्या होता है? ये होता है, इसका फंक्शन क्या होता है? इंश्योर करना रैशनल ड्रग यूज एंड मॉनिटर द एडवर्स रिएक्शन. ऑप्शन बी इज द करेक्ट वन. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 11. एंड वन थिंग इज दैट कि आपको जो भी मैं क्लासेस प्रोवाइड कर रही हूँ इसका जो PDF है अच्छी तरीके से विजिबल है या नहीं, एंड साउंड एक बार क्लियर कर देना, ठीक है. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 11. अंडर द ड्रग एंड कॉस्मेटिक एक्ट विच लाइसेंस इज रिक्वायर्ड फॉर द हॉस्पिटल डिस्पेंस नार्कोटिक ड्रग. Question is that under the Drug and Cosmetic Act, which license is required for a hospital dispense narcotic drug? The first one, Form 21C license. Second one, Form 20B license. Third one, Form 20 license. And the last one, Form number 19 license. Which is the correct one? So ये क्या होता है? ये होता है Form number 21C. क्या होता है? फॉर्म नंबर 21C. ऑप्शन ए इज द करेक्ट वन. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 12. द टर्म वार्ड स्टॉक इन द हॉस्पिटल फार्मेसी रेफर्स टू व्हाट? द फर्स्ट वन, ड्रग डिस्पेंस डायरेक्टली टू द पेशेंट. सेकेंड वन, बल्क मेडिसिन स्टोर्ड इन द सेंट्रल फार्मेसी. थर्ड वन, प्री सिलेक्टेड मेडिकेशन kept in the patient care areas for immediate use. And the last one, expired drug disposal area. The question is that the term ward stock in the hospital refers to what? That is pre-selected medication kept in the patient care areas for immediate use. Option C is the correct one. Moving to the next question, question number 13. Which of the following is not a criteria of ABC analysis? Question is that not a criteria in the ABC analysis. Option is here. The first one, annual consumption value. Second one, criticality to the patient care. And third one, total expenditure during the period. Last one, uses rate. Which is the correct one? So, which is not a criteria of ABC analysis? These are the criteria. The first, annual consumption value, total expenditure during the period, and last, uses rate. अभी पूछा है नॉट क्राइटेरिया इन द ABC एनालिसिस, दैट इज क्रिटिकलिटी टू द पेशेंट केयर. ऑप्शन बी इज द करेक्ट वन. मूविंग टू द नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 14. दिस मोस्ट इज द इम्पॉर्टेंट क्वेश्चन फॉर योर एग्जामिनेशंस. हॉस्पिटल फार्मेसी ऑफन यूज FEFO for the stock rotation. What is FEFO stand for? The first one, first expired, first out. Second one, first entered, first out. Third one, first examined, first out. And the last one, first evaluated, first out. Which is the correct one? So, FEFO stand for, that is first expired, first out. That is first expired, first out. Option A is the correct one. Next question, question number 15. Which community is responsible for receiving hospital antibiotic policies? Which community is responsible for reviewing hospital antibiotic policies? The first one, infection control committee. Second one, pharmacy therapeutic committee. Third one, clinical audit committee. And the last one, quality management committee. Which is the correct one? Which committee is responsible? That is Pharmacy and Therapeutic Committee, that is PTC, Pharmacy and Therapeutic Committee. Next question, committee. Next question, question number 16. The legal retention period for the prescription record in the hospital pharmacy is the retention period for the prescription record. For the prescription record in the hospital pharmacy is 1 year, 2 year, 5 year, 10 year. Which is the correct one? The legal retention period for the prescription record in the hospital pharmacy is, that is 5 year. That is 5 year. Option C is the correct one. Next question, question number 17. A hospital pharmacy budget planning primarily depends on what? The first one, previous year patient census data. Second one, market price fluctuations of housekeeping supplies. Third one, salaries of administrative staff. And the last one, local rent rates. Which is the correct one? That is previous year patient census data. Option A is the correct one. Moving to the next question, question number 18. Which form is used to requisition narcotic drug within the hospital from the main stored ward? Which form is used to the requisition narcotic drug within the hospital from the main store to the ward? Which is the correct one? The first option, form number M. Second one, form number 19. Third one, form number 24A. And the last one, form number 21B. Which is the correct one? So option C is the correct one, that is form number 24A. Next question, question number 19. In the hospital pharmacy, unit dose dispensing system, that is UDDS, helps in what? The first one, reducing drug wastage and medication error. Second one, minimizing the manpower requirement. Third one, automating drug compounding. And last one, enhancing the drug manufacturing. Which is the correct one? In the hospital pharmacy, UDDS, that is unit dose dispensing system, help in what? That is reducing the drug wastage and medication error. Helps in reducing drug wastage and medication error. Option A is the correct one. Next question, question number 20. Which seizure device is commonly used to prevent diversion of controlled substance in the hospital pharmacy? Which seizure device is commonly used to prevent diversion of controlled substance in the hospital pharmacy? The first one, ADC, automated dispensing cabinet. Second one, mechanical counting machine. Third one, vacuum packaging machine. And the last one, heat sealer. Which is the correct one? That is ADC. ADC refer towards automated dispensing cabinet. That is option A is the correct one. Next question, question number 21. The formulary in the hospital pharmacy is defined as, first one, a medical equipment, a list of medical equipment. Third one, a list of approved drug and the therapeutic guideline for their use. Third one, a schedule of surgical procedure. And the last one, a manual administrative policy. Which is the correct one? The term formulary in the hospital pharmacy is defined as, the a list of approved drug and the therapeutic guideline for their use. Option B is the correct one. Moving to the next question, question number 22. A hospital has 300 bed according to the WHO. It is classified as, most important question. A hospital pharmacy has 300 bed according to the WHO. It classified as, the first one, small hospital. Second one, medium hospital. Third one, large hospital. And the last one, super speciality hospital. Which is the correct one? So hospital has 300 bed, that comes in large hospital. Option C is the correct one. Okay. Next question. The primary advantage of an automated dispensing system is, the first one, increase the drug shelf life. Second one, real time inventory control and reduce the dispensing error. Third one, lower the initial setup cost. And last one, simplified personal training. Which is the correct one? इन द प्राइमरी एडवांटेज ऑफ ऑटोमेटेड डिस्पेंसिंग सिस्टम इज, क्या होता है, ये होता है दैट इज रियल टाइम इन्वेंट्री कंट्रोल एंड रिड्यूस dispensing error. Option B is the correct one. Next question, question number 24. Which of the following is not a part of hospital pharmacy compounding services? The first one, preparing extemporaneous formulation, repackaging bulk stock into the unit dose. Third one, manufacturing of sterile parenteral. Last one, clinical diagnosis of patient. Which is the correct one? So which is not पूछा है, तो not a part of hospital pharmacy, that is clinical diagnosis of the patient. Option D is the correct one. Moving to the next question, question number 25. The main objective of ward clinical pharmacy service is to. The main objective of ward clinical pharmacy service is to. The first one, replace physician in the patient diagnosis. Second one, provide patient counseling and optimize therapy outcomes. Third one, manage hospital administrative tasks. And last one, conduct the clinical trial. Which is the correct one? So option B is the correct one. Provide the patient counseling and optimize the therapy outcomes. Option B is the correct one. Moving to the next question, question number 26. Which type of hospital is primarily funded by philanthropic organization? The first one, hospital pharmacy. Second one, charitable hospital. Third one, government hospital. And the last one, teaching hospital. Which is the correct one? It comes in charitable hospital. Charitable hospital. Option B is the correct one. Next question, question number 27. Under the drug and cosmetic rule, hospital pharmacy must maintain record all the transactions of. The first one, Schedule C and C1 drug. Second one, herbal medicine only. Third one, over-the-counter product. And last one, hospital consumable. Which is the correct one? Under the drug and cosmetic rule, hospital pharmacy must maintain the record of all transactions. Question number 27. So which one? That is Schedule C and C1 drug. Which one? Schedule C and C1 drug. Option A is the correct one. Next, the term benchmarking in the hospital pharmacy management refers to. The first one, measuring performance against the best practices. Second one, setting the drug price based on competitor. Third one, inventory stock leveling. And last one, staff performance review. Which is the correct one? The term benchmarking in the hospital management refer to what? Measuring the performance against the best practice. क्या होता है? Measuring performance against the best practices. Option A is the correct one. Next question. The par level of inventory refers to what? The first one, maximum stock level that can be held. Second one, minimum stock level to the trigger recorder. Third one, average consumption rate. And the last one, expiry threshold. Which is the correct one? The par level of inventory refers to minimum stock level to the trigger recorder. Option B is the correct one. Next question. Question number 30. Which temperature range is recommended for storing most hospital pharmacy drug? कर लेना वहाँ पे. Which temperature range is recommended for storing the most hospital pharmacy drug? In between the 2 to 8 degrees Celsius. Second one, 20 to 25 degrees Celsius. Third one, 15 to 13 degrees Celsius, 30 degrees Celsius. And the last one, 35 to 40 degrees Celsius. Which one is the correct one? So, keep between the 20 to 25 degrees Celsius. Okay, option B is the correct one. Next question, question number 31. Which of the following best define pharmaceutical care in the hospital pharmacy? Which of the following best define pharmaceutical care in the hospital pharmacy? The first one, selling medicine at discount price. Second one, responsible provision of drug therapy to achieve the outcome that improve the patient quality of the life. Third one, bulk manufacturing of the generic drug. Last one, conducting academic research. What is the correct answer? Define pharmaceutical care in the hospital pharmacy. That is, responsible provision of the drug therapy to achieve the outcome that improve the patient quality of the life. Responsible provision of the drug therapy to achieve the outcome that improve the patient quality of the life. Option B is the correct one. Moving to the next question. Question number 32. The duration of retention of inpatient drug profile record is. The first one for 1 year, second one second year, third 5 year, and the last one period of hospitalization. The duration of retention of inpatient drug profile record is. कितना होना चाहिए? That is 5 year. कितना होता है? 5 year. Option C is the correct one. Next question. Question number 33. Which method is used to analyze drug usage trend in the hospital? Which method is to analyze the drug usage trend in the hospital? The first one, SWOT analysis. Second one, drug utilization up to the 90%. Pastel analysis. And last one, fishbone analysis. Which one is the correct one? So ये होता है that is drug utilization 90%. Drug utilization 90%, that is DU 90%. Option B is the correct one. Next question, question number 34. The hospital committee responsible for monitoring hospital acquired infection is. The hospital committee responsible for monitoring hospital acquired infection is. The first one PTC, second one Infection Control Committee, third one Quality Management Committee, and the last one Safety Committee. Which one is the correct one? The hospital committee responsible for monitoring the hospital acquired infection, that is Infection Control Committee. Option B is the correct one. Next question. Question number 35. Under NABH guideline, hospital pharmacy are mandated to maintain what? Option first, patient grievance register. Second one, standard operating procedure. Third one, employee maternity record. Last one, dietary plan. Dietary plan. Which is the correct one? Under NABH guideline, hospital pharmacy are mandated to maintain, that is standard operating procedure, that is SOPS. Okay. Option B is the correct one. Next question, question number 36. Which system uses barcode technology to reduce medication error at the point of administration? Question is that which system uses barcode technology to reduce medication error at the point of administration? The first one, computerized physician order entry. Second one, barcoded medication administration. Third one, automated dispensing cabinet. And last one, unit dose packaging. Which one is the correct one? That is barcoded medication administration. Option B is the correct one. Next question, question number 37. The legal notice period for the destruction of expired controlled substance require so how many days in advance? 7 days, 21 days, 14 days, 30 days. Which is the correct one? कितना होना चाहिए destruction period? That is 14 days. That is 14 days. Option C is the correct one. Next question, question number 38. A hospital pharmacist's role in pharmacovigilance included what? The first one, conducting clinical trial independently. Second one, reporting and monitoring adverse drug reaction. Second one, third one, issuing surgical orders. And last one, diagnosing infectious disease. Which is the correct one? A hospital pharmacist's role in pharmacovigilance included, that is रिपोर्टिंग एंड मॉनिटरिंग एडवर्स ड्रग रिएक्शन. ये भी क्वेश्चन आपके शायद प्रिजन में पूछा था. ठीक है. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 39. Which of the following is not a function of central sterile supply department? Central sterile supply department. The first option, sterilizations of surgical pack. Second one, storage of sterile atom. Third one, distributions of medicine to the ward. Last one, preparation of instrument trays. Which is the correct one? Which is not a function of CSSD, that is Central Sterile Supply Department. Which is the correct one? That is distributions of medicines to the ward. Option C is the correct one. Next question, question number 40. The primary advantage of on-site hospital pharmacy compounding unit is. The primary advantage of on-site hospital pharmacy compounding unit is. The first one, reduce the waiting time for the sterile preparation. Second one, increase reliance of external vendors. Third one, higher cost of raw material. And the last one, lower the quality control. Which is the correct one? The primary advantage of on-site hospital pharmacy compounding unit is. Which is the correct one? So क्या होता है ये होता है that is reduce the waiting time for the sterile preparation. Reduce waiting time for the sterile preparation. Okay. So this is our last question. ये फाइनल हमारा लास्ट क्वेश्चन था टॉप 40 में से. ओके. सो ये क्लास आपको रिवाइज करनी है थ्रू दैट PDF और द क्लास. एंड जिनको टेस्ट सीरीज़ लेना है बाय कर सकते हो थ्रू मेंबरशिप का लिंक गिवन है, या फिर आप चैनल के बिसाइड्स में जो ज्वाइन बटन दिख रहा है वहाँ से ज्वाइन कर सकते हो. DMER टेस्ट सीरीज़ जहाँ लिखा है जिसकी कॉस्ट है ओनली 190 रुपीज़, 99 रुपीज़. ठीक है. सो थैंक यू फॉर वॉचिंग. मिलते हैं नेक्स्ट क्लास में. तब तक के लिए आपको क्या करना है, क्लास को लाइक करना है, शेयर करना है एंड सब्सक्राइब भी करना है. ठीक है. और जिन लोगों ने अब तक सब्सक्राइब नहीं किया है सब्सक्राइब भी कर लेना. ठीक है. वंस अगेन थैंक यू फॉर वॉचिंग. मिलते हैं नेक्स्ट क्लास में. तब तक के लिए बाय बाय.